Hello and welcome to the Stabilization Academy video show, where we delve deep into the mechanics of human movement to help health professionals enhance their practice. I'm Tracy, and today we're discussing a fascinating topic, planes of motion and how we can use them in gait assessment. But before we dive into the common gait compensation, let's first understand the planes of motion. The human body moves through three primary planes: the sagittal plane, the frontal plane, and the transverse plane. Now we're going to discuss the common gait compensations and their implications, particularly focusing on the movements in the sagittal plane. The sagittal plane divides the body into left and right halves, involving forward and backward movements like walking and running, so looking at extension and flexion. The frontal plane splits the body into front and back halves, including side-to-side movements. So we're looking at abduction or adduction. And lastly, the transverse plane divides the body into top and bottom halves, encompassing rotational movements. Now we're going to discuss the common gait compensations and their implications, particularly focusing on the movements in the sagittal plane. First, let's start off with pronation. So pronation involves the natural inward rolling of the foot after heel strike, which is crucial for shock absorption. However, if pronation does become excessive, it's usually due to a weak anterior column muscles. And you will see bulging at the sustentaculum tali, where the arrow is pointing to on the left-hand diagram. That's actually a normal pronation right there, because I don't actually see too much of excess pronation. But what I do see is here on the right, when people have a weak anterior column and they can't dorsiflex adequately, you get supination at heel strike through to mid stance. Next up, we have progression angles, or out-toeing and in-toeing. So these are usually compensations due to internal tibial torsion or external tibial torsion. When you have an increased progression angle, it is quite normal for a person with external tibial torsion for them to walk with their feet outwards. And if you get them to walk with their feet straight ahead, they will immediately get medial knee pain, as this is a normal gait pattern for them. However, an increased progression angle can also occur as a compensation for internal tibial torsion, depending on what's going on at the hip and the forefoot. However, with internal tibial torsion, and depending on whether they've got anteversion at the hip as well as internal tibial torsion, you can actually get a decreased progression angle where you've actually got in-toeing, where the heel hits the ground and the whole leg rotates in. Then you know that someone has a very shortened gluteus medius that's not eccentrically lengthening or contracting with internal hip rotation. And then because of that, it goes all the way down the leg, and you see the whole entire leg swivel in, and the person will walk on the outside part of their foot. Next, we have a crossover gait, which happens when the feet land too close to the midline of the body, moving out of the sagittal plane. This tells us that the glutes are not firing as they should, and this can increase stress on the IT band and lateral knee structures. You may also see scuffing on the inside part of the leg or on the medial aspect of the rear part of the shoe. And then we have the Trendelenburg gait. And this occurs when the hips drops on the swing side, indicating weakness in the hip abductors and the abdominals. You'll also have the opposite side, which is the stance side. The lower back and the glutes have to work harder to stabilize the pelvis. On this last slide, we can see a lot of internal rotation of the femur, causing a knee valgus here. And this usually coincides with the whole body leaning to the lateral aspect, which is the blue line, leaning over. And also you have some lateral spine flexion, some lateral hip movement, particularly on that side as well. You can also get excessive trunk rotation, which involves too much rotation of the trunk in the transverse plane during gait, and this is often due to very weak core muscles. This can also lead to inefficiency with energy use and strain on the lumbar spine, which causes lower back pain and reducing running efficiency. Understanding these compensations and the planes of movement can greatly enhance your assessment and treatment of movement and gait-related issues. And by focusing on these elements, as health professionals, we can develop more effective intervention strategies, improving client outcomes and reducing injury risk. Now, if you're interested in learning more about gait analysis and how to address common compensations effectively, join our upcoming webinar at the end of June, where we will delve deeper into the biomechanics of walking and running and offering practical insights and techniques to enhance your clinical practice. Don't miss this opportunity to elevate your skills and improve client outcomes. Register now on the webpage. Thank you for joining us today. Be sure to subscribe for more insights and updates, and I will see you next time. Ciao.